Hi, I'm Dr. Jacob Teitelbaum, Medical Director of the Fibromyalgia and Fatigue Centers. In this discussion, we're going to talk about chronic fatigue syndrome, fibromyalgia, and myalgic encephalomyelitis, or ME, teach you what's causing them and how to make them go away. Now, there are many of you out there that are suffering with these illnesses, and you're not alone. The research is suggesting that it has increased in frequency by over 400% in the last decade alone, and now affects as many as 6 to 12% of the population. The good news is that these are now very treatable, and we're going to teach you how you can get your life back and get well. Now let's start by how you can tell if you have these symptoms or these illnesses. And the illnesses are reflected by a combination of exhaustion and insomnia. And if you have those two and they don't go away with vacation, because if you're exhausted, you should sleep all day and all night, then you probably have this illness. Most of you, but not all, will have widespread pain, which makes it fibromyalgia. You'll have brain fog, and you'll find that the average weight gain is 32.5 pounds. 73% will have loss of libido. About 3/4 of you will have numbness and tingling in your fingers and face and elsewhere. So there's a mix of symptoms, but basically exhausted and can't sleep would be the hallmark of the illness. Now these illnesses, and each of these are different but very strongly related, reflect an energy crisis in your body. It's like blowing a fuse. When you can't make enough energy for your body's needs, the area that uses the most energy for its size will go offline first. And that area is called the hypothalamus. So basically it's like blowing a fuse or a circuit breaker, and that circuit breaker that goes offline, the hypothalamus, controls sleep, which is why you can't sleep even though you're exhausted, your entire hormone system, which is why you need hormonal support even if your blood tests are normal. It controls temperature regulation and blood pressure, blood flow, and sweating. Now, I had chronic fatigue syndrome back in 1975. I had what I call the drop-dead flu, which is a common trigger for the illness. A common way to blow the fuse is a viral or other infection. It actually left me homeless and sleeping in parks for a good part of that year. The interesting thing is I learned more how to effectively treat this illness while I was homeless, having met nutritionists, acupuncturists, chiropractors, naturopaths, and a host of healers while I was homeless and hitchhiking. I learned more about how to get well from them than I did from my professors in medical school. And what our research has shown, and we've treated over 3,000 patients in the last 30 years with CFS and fibromyalgia, is that when you use the SHINE protocol, SHINE stands for sleep, hormonal support, infections, nutritional support, and exercise as able. If you exercise to crashing, you're hurting yourself. But by treating with SHINE, our published research studies show that 91% of you can improve, and in about half of you, your fibromyalgia and chronic fatigue syndrome will effectively go away. So if you would like to see the full text of our study, it can be seen at our website at vitality101.com. And how to treat this illness is discussed in my book, From Fatigue to Fantastic, which is the best-selling book on CFS and fibromyalgia. Also, there are now physicians throughout the country at the Fibromyalgia and Fatigue Centers, but also there's over 1,000 board-certified holistic physicians at www.holisticboard.org that know how to treat these illnesses. So it's time for you to get well, and we're going to have a 7-part series that I invite you to watch that will teach you how to treat the individual components of CFS and fibromyalgia, which will be the SHINE protocol, and then also how to get rid of your pain and what you can do now to get well. So this is Dr. Jacob Teitelbaum, inviting you to join us for the rest of the series and wishing you great health.